There is some big news coming out of Hartford HealthCare regarding mental health. Patricia Rehmer is the Senior Vice President at Hartford HealthCare and President of the Behavioral Health Network. She is joining me now. Thank you so much for being with us.
Thank you for having me, Kara.
So a new study says that as many as 75,000 Americans are at risk of dying from suicide or an overdose as a result of all the stress that has been related to COVID-19. That sounds like a huge number. Can you weigh in on that?
Yeah, I think it is a very concerning number, and I think that's one of the reasons, frankly, that we need to have call lines like this, because we have got to get ahead of this. People are extremely stressed. They've lost their jobs, they have been isolated, they have lost family members or friends to this, and it's just overwhelming. And so we're very concerned about increased depression, increased anxiety, increased substance use, and this is a way for us to be available to people who are struggling 24/7.
And so you've launched this expanded community care center hotline. Big news, because this is 24 hours a day, 7 days a week, and it's free for anyone who needs it?
That's correct. The line can, it's available for people who have some emotions that they need to talk about. It's available, and most importantly, for people who would like to potentially speak with somebody or schedule an appointment. We can do that via telehealth, or we can do it in person at any one of our locations. We are open across the behavioral health network, and we really do think that if people need treatment, we want to make sure that it's available to them.
What kind of questions will the staff be able to answer if you call this line?
Well, I think initially, just so people know, the staff will ask for a name and phone number, and that's just in case the call gets dropped. We want to make sure that we are able to stay in contact. And then we'll be, asking people, what are they calling for? Are they calling because they want to talk about some experience they've had that day? Are they calling because they feel like they've been experiencing some symptoms of depression or anxiety for a period of time? They're calling because their children are struggling and they're not quite sure what to do with that. This is really a phone line that will be open for anyone that wants to talk with us about behavioral health concerns, or again, seek some sort of intervention that may be more in person.
Right. Patricia Rehmer, thank you so much, and so great for everyone out there to know, to share this information, that this is 24 hours a day and it's free. Thank you so much for being with us.
Thank you, Kara.